of the Your Health is Important Facebook Live broadcast. I am Dr. MJ Collier, your host, producer, and on-air personality, and we're here to answer your healthcare questions. We're coming to you live right now to give you an opportunity to discuss whatever health topic you'd like to discuss, any medication questions, any disease states, and we're going to start the show right now. Thank you so much for tuning in. And we appreciate you so much for joining us here this evening. This is the Your Health is Important Facebook Live radio broadcast. And I just want to say thank you, each and every one of you, for joining us today. Hey, Shantae Washington, so glad that you have joined us. As always, you are a regular and we love you madly. So we're going to talk about a couple of things. One, tomorrow, the masks are coming off. Where? At Disney World and Disneyland. The theme parks are the latest to say that the pandemic has reached a place at which making people wear masks indoors is no longer appropriate. So we are at that point now where people have, for whatever reason, decided that the pandemic doesn't require them to do. Hey, Austin, how you doing? Appreciate you. So people don't feel as if they need to wear masks, they need to social distance, and this is a problem. Hi, Mary Holmes, we are so glad that you joined us this evening. And the problem being that we are not out of the pandemic. The World Health Organization says that it is very important that we do not stop testing. Hi, Tamika. Thank you so much for joining us this evening. Tamika Evans joining us. Tell us where you're joining us from, too. You know, we always want to know that. And because we want to make sure that we're covering this entire United States, North, South, East, and West, Hawaii, all those things. Ernest Gibbs, a regular. Thank you so much for coming in, and good evening to you as well. So with the World Health Organization, the WHO, the WHO, telling everybody we still need to be testing, we still need to be masking, we still need to be doing a variety of things because we are close. We are so close, but we don't want to be premature in our lack of response. Jackie Daniels from Tallahassee, thank you so much, Jackie. Yvonne Mitchell Gibson Johnson from LA, California. Okay, North, South, East, and West. We really appreciate you for joining us. Mary Holmes from Chicago. Everybody's joining in now. We have some new faces. We have some regular listeners and regular participants. And remember, this is interactive. Sean Big Time Green is in the house from Monroe, Louisiana. We want to make sure that you participate, ask your healthcare questions so that we can talk about what it is that you want to talk about. Tamika's from Virginia. Okay, so we got Midwest, we got West, and I'm sure we have East Coast, Benbrook, Texas. Okay, Monica Felton from Benbrook, Texas. And so we want to see who we have from the local area, Atlanta, New York, North and South Carolina, Florida, all of those places. Tune in right now and we're going to talk about it. So there was some erroneous information on the internet today. It shows you how dangerous the internet can be. That internet posting stated that the Queen of England had passed away. Austin from Atlanta. Okay, now we're talking. So the Queen has not passed away. She's still with us. She contracted COVID and tested positive on Monday of this week. And she has been, quote, having mild symptoms, and she's been supported. Remember, the Queen is 96. So, she is definitely in the highest risk category. So we want to wish her well and hope. But as of this day, as officially has been announced, she has not died yet. Yvonne Mitchell Gibson, thank you so much. I appreciate you, and you are a blessing for tuning in as well. And so, don't pass misinformation, but that just shows you how quickly misinformation can spread, one, and two, how people will quote it as the gospel. Marsha Houston from Austin, Texas. Thank you so much, Marsha Houston from Texas. We appreciate you as well for tuning in. So same thing about misinformation about the coronavirus, the pandemic, the things that you have been hearing, particularly about the vaccines, about medications that are being utilized like hydroxychloroquine and ivermectin, which people are literally suing doctors to get them to write and treat patients with. And they are just not needing this medication. There's been no shown activity that this works, that it is a positive. We do have two active therapies. We have the antibody therapy, where they give you an infusion of antibodies against the coronavirus. And now we have oral pills that are antiviral that are directly targeting the coronavirus pandemic. Those are active therapies. Everything else are preventive. That is what the vaccines do. They prevent you from hopefully getting it. But if you do get it, they want to make sure that your case is mild and that you're not hospitalized and that you don't die from it. That's all we can ask from a vaccine, that it minimizes our symptoms and that we don't die when we catch the disease. And the vaccines have lived up to that promise. As I announced during our last broadcast, the Johnson & Johnson vaccine is no longer being manufactured, period. There's enough of it on the shelf. And that's one of the reasons why, because it is the third choice vaccine and a lot of it is left over and it will expire if it's not utilized. So they have a backlog. They need to use that, what's in the pipeline. They're not taking it off the market. It is still available. There are still appropriate circumstances to use it, particularly if you can't be sure that the person will show up for a second shot. So a one shot, a one time is a good enough therapy for them. So that's where we are this evening with that. And now we're going to get to your questions. We want to spend a lot of time answering your healthcare questions. So let's get it going. Okay. Diane Welton Hardy says, Dr. Collier, I would like to know if you were diagnosed with having COVID on January 16th, but still have residual coughing. When should you get the booster? The booster, you can get it at any time. And the residual coughing, now you are free of the COVID infection, but you have some inflammation, bronchitis that's causing you to cough. Again, very important that you take anti-inflammatories like omega-3 fish oil. Our lipo omega is excellent for that. The vitamin D is a natural anti-inflammatory. The dose should be 5,000 international units per day, as noted in our doctor's D formulation. And then the lipo immune, which has zinc and vitamin C, along with elderberry extract. All of those things will help minimize the symptoms of long COVID, will help minimize the symptoms of coughing, a lot of virtually everything, loss of sense of taste and smell. All of those are due to the inflammation that's caused by infection with the coronavirus. And you treat the inflammation with anti-inflammatories. And all of these are natural agents. They're not medicines. They are supplements. So, but they will give you the treatments that you need. You can go to the doctor, but there's no prescription they can write for you that you will benefit greater from than these anti-inflammatories that you will get. Prescription anti-inflammatories and also over-the-counter in lower doses, Motrin, Advil, or Aleve. Let's get the rumor right now. Tylenol is not an anti-inflammatory. Tylenol is an anti-pain medication. It stops you from hurting, but it does not decrease inflammation. So it's very important that if you are eligible and can take an anti-inflammatory, you don't have a history of stomach ulcers, and you're not on blood thinners, then you should take a Motrin, Advil, or Aleve, which are already available over the counter. If you are in that circumstance, history of stomach ulcers, or you're on blood thinner medication such as Plavix, then you need to make sure that's Plavix / clopidogrel. You need to make sure that you are only taking Tylenol, but you should be well versed in that if your doctor has prescribed it for you. Okay, Diane, thank you so much. Great question. Angela Haynes Lewis, I'm from Gainesville, Florida. Great, Angela. Okay, I'd like to know if lipo would assist me with weight loss while I'm doing keto. Absolutely. The keto diet is not a new scientific principle. It was the original Atkins diet, then the South Beach diet, which was a modified Atkins diet. But the whole premise behind that is that the foods that you eat are of such high density that it requires more energy to digest those foods than there are calories in the foods. So there's actually a net loss from consuming those foods. And they're usually foods that we like bacon, steaks, cheese, things that people really, really enjoy. And they were just shocked and surprised that they could be on a diet that was high in these particular things and still lose weight. And so, yes, you can. So you can do keto. We have a product, our Keto Max, that gives you artificial ketosis state so that you don't have to go in full-fledged keto. When you do it in the keto diet, one of the problems is that in the state of ketosis, your body is acidic. And it causes you to have very foul breath that has nothing to do with your oral hygiene. So you can't brush your teeth and gargle it away because it's coming from inside of you. And it also causes all of your body fluids to be foul. So your underarms, your female areas for women, your male areas for men, all have a less than positive aroma about them. And that's just not a good thing. We call it keto crotch. So, you can avoid that by going straight to the Keto Max product. But all of the lipo line is perfectly acceptable and compatible with a keto diet. They will help you metabolize the fat even more so, because you still need the amino acids that are in our Lipodrops Max to metabolize fat. Ketosis forces your body to metabolize fat. Well, Lipodrops Maximum Strength formula, it will make that much easier for your body to accomplish. So you will lose more weight probably and quicker and without some of the downside for a keto diet. Thank you, Angela. Great question. Anything I can do to fix my stomach when recovering from stomach virus? Yes, you can, Brianna. Probiotics are absolutely incredible because your stomach and your entire GI tract is lined with various types of bacteria. When you get a viral infection, two things cannot occupy the same space at the same time. So the virus displaces usually the good bacteria that's in your gut. So you need to replace that good bacteria and stabilize the immune system, what's called the biogen in your stomach. So to do that, probiotics are the most effective way to do that. Now you can do it naturally, even more natural, by eating Greek style yogurt. Greek style yogurt has the highest amount of the good bacteria in it, the probiotics, and it's just a problem of eating it every day and having enough refrigerated space so that you can put, say, a week to 2 weeks supply in it. Whereas you get the bottle of the lipobiotics, you just take one capsule in the morning, one capsule in the evening, and you will quickly restore your stomach to not just normal, but to a high qualitative state. This qualitative state helps with your regular digestion. It also helps with your immune system status. So a lot of things a lot of foods that you may be allergic to, or other allergy symptoms such as eczema, asthma, sinus congestion, sinus drainage, itchy eyes, scratchy throat. All of those symptoms can be muted and or even totally relieved by going on a probiotic regimen. So I highly recommend that probiotics are good for immune system and GI health. A combination to optimize your health would be all four of those things: the lipoimmune, the vitamin D, the omega-3 fish oil, and the probiotics that you see in the background. So go to the website lipodrops.com, and you'll get more information about what you can do to boost your immune system and fix that stomach of yours. Thank you, Brianna. Great question. Okay, Penny Roberts, can having hypothyroidism have an effect when taking lipodrops? Yes, hypothyroidism can have an effect because hypothyroidism makes it more difficult for you to lose weight. The lipodrops are perfectly compatible with that disease state because they enhance your body's ability to lose weight. So it kind of counters the negative effect from the hypothyroidism. But the best thing to do with the hypothyroidism is to correctly replace the thyroid. So thyroid disease state is a problem when your thyroid levels are too low. For any hormone in your body, there's a range of normal. So if this side is low and this side is high and everything between my two hands is normal, you don't want to be outside the low range, which is what by definition hypothyroidism is. So you want to be, worst case scenario, you want to have enough thyroid replacement to get you in the middle. Best case scenario, you want to be on the high side of normal, which will optimize your thyroid function. The problem is that most doctors will undertreat thyroid disease, and they will only give you enough to get you back into the normal range, but not treat you optimally. So doctors can be shy about it or just not comfortable treating it. This is not a big problem that you need to go to an endocrinologist about. Most primary care doctors can treat it, but you need to form a partnership with your provider and let them know that you want to be optimally thyroid treated. You want to make sure that you push your thyroid as high as you can. That will keep your weight down. It will keep your muscle mass high, your body fat low. It would also increase your concentration ability, so you're not foggy brain or easily distracted. Like a lot of people think they have ADD, and they can even test positive for it because they meet all the criteria. It's just like having ADD, but the problem is not that, it's that they have hypothyroidism, which is a low thyroid disease. Now that's different from hyperthyroidism, which is too much thyroid hormone. And so that condition called Graves' disease can be, it creates a whole nother set of problems, usually just the opposite, like being on stimulants nonstop. So you lose a lot of weight in an inappropriate amount. Your heart rate and pulse rate is racing. You have no energy because your body is wasting all of its energy, keeping your heart rate beating so fast. So that's hyperthyroidism. But the answer to your question is hypothyroidism and lipodrops. Yes, very compatible, good option, and good add-on in treating to help keep your weight down. Thank you, Penny. Great question. Okay, Marlene Kennedy states that a family member went to urgent care for stomach pain, and after a CT scan with contrast, the incidental finding was fatty liver. So, fatty liver means that you have basically so much fat intake that your body is now storing fat in and around your liver, and as fat starts to accumulate in your liver and in or around your other internal organs, that one predisposes you for bad things like diabetes. Is highly associated with cardiovascular disease risk, i.e., heart attacks or strokes. So it's best when you, and the problem is that when you lose weight, that's not going to be the weight that's usually targeted. You're going to lose peripheral fat, and what you want to lose is that central fat, particularly what's involving and infecting and impacting the liver. So this is serious enough because it can cause negative impact on your liver and cause your liver not to be able to function as well as it should. So the ideal situation is to lose weight, lose the fat, and products such as the Lipodrops and the Keto Max could help you lose weight, particularly from your central areas. We call it losing the muffin top with Lipodrops because you cannot target weight loss under normal circumstances. The low-hanging fruit is the fat that's peripheral, that's your arms and legs. And what you want to do is lose the weight in your gut. Everybody wants to lose the inches in their abdomen. And so one of the things that helps with that tremendously is the amino acids that are in the Lipodrops formulation that help your body metabolize fat. But this is not a situation where going to the gym and doing crunches is going to help. Remember Dr. Collier's catchphrase: you do not lose weight in the gym. You lose weight in the kitchen. You lose weight in the kitchen by the foods that you take in, the number of calories that you take, and how many calories you burn. That is performed in the kitchen eloquently. So you go to the gym to get fit and to improve your cardiovascular fitness level, build your muscle mass, etc. Billy Sue Combs, I want to try the Lipodrops, but I'm concerned since I have Graves' disease, SVT, and high blood pressure. Lipodrops are perfectly compatible with those disease states. SVT is supraventricular tachycardia, and that's caused by the Graves' disease, which I said earlier can cause a rapid heart rate. So there are no stimulants in the Lipodrops product, so it's not going to cause any problems as far as your Graves' disease symptoms are concerned. You want to make sure that you are having your hormone, your thyroid levels muted. And there are three options for that. There are medications that can lower the function of the thyroid. You can literally take radioactive iodine intravenously. It goes to the thyroid and literally burns the thyroid out, stops the thyroid from working. That means you're going to, at that point, always have to take thyroid supplements. So that is an option. Another option is to either surgically remove a portion of the thyroid. Sometimes they remove a quarter of it. Sometimes they remove one half of it. The thyroid gland is located in the anterior part of the neck and is shaped like a butterfly. So you have two butterfly wings going this way, and then the central butterfly right in the center of the butterfly's body, right over your trachea here. And then you got two wings up, two wings down, wide wings like a nice butterfly. So they can take off one quarter of the wing, they can take off half on one side, they can take off the entire thyroid. Once again, the two options of getting the radioactive iodine and taking the whole thyroid out means you're going to be on thyroid replacement for the rest of your life. But sometimes that is necessary if it cannot be medically controlled. There are medications, once again, that block the function of the thyroid. And then there are other medications, particularly antihypertensives in the beta blocker class, that slow the heart rate down and control the heart rate. So make sure that you are working well with your internist, your primary care family physician, or your endocrinologist. All of these doctors need to work together to make sure that you are being optimally treated to keep your Graves under control. But one thing about Graves has oftentimes an autoimmune component. And one of the things that I recommend is to take medications or supplements that will help with that condition. That would be natural anti-inflammatory vitamin D, omega-3 fish oil, and probiotics. All are very, very good for helping the body not attack itself so much and not attack the thyroid gland or other autoimmune diseases such as lupus, etc. Those supplements are absolutely incredible for lowering the inflammatory condition and can help really with a lot of the things, a lot of the problems that are caused by the Graves' disease proper. Great question, Billy Sue. I want you to make sure you always listen. Okay, Linda, so we're still talking about the tightening of the loose skin. Collagen, once again, I hope you heard me answer this again. It's good to help do it, but if the skin is too loose and it really is, it's not just loose skin, but flaps of skin, collagen is not going to help give you the cosmetic effect that you like. The best situation for that is cosmetic surgery, where they literally remove the flaps of skin and tighten that skin up. But collagen can tighten up, but more importantly, optimizing your muscle underneath the skin, so that you have a better, a more appealing cosmetic appearance by optimizing your muscle mass under that. So frequent lifting of lighter weights will help tone the muscles. A toned muscle makes the skin look better, and that should help give you the look that you like and desire. Okay, Leonard, thank you very much. Okay, now, yeah, we had connection issues, but I think we're back. Okay. Is there an effective home remedy for a UTI? Makiba, how you doing, darling? No, there's no home remedy for it. Once you have a UTI, it's going to have to be treated, usually with an antibiotic, of course, and there are ranges of antibiotics. There are some mild ones, some that are kind of strong, and some that are really strong. And so it just depends. But preventing a urinary tract infection, that's another deal. And so once again, I think that the probiotics are good with that, because they help maintain a normal bacterial count in your private areas, your female areas, because oftentimes a urinary tract infection is caused by bacteria that are outside the vagina and the urethra, where you urinate from. And one thing about intercourse will push those germs into a place that they normally aren't. And that's why when you have intercourse, it's very important that you empty your bladder immediately. So it changes the whole mood. You have to get up, go to the bathroom, empty your bladder. So I will often say, when this happens, drink water before a sexual intercourse. And by the time you complete the act, your bladder should be full and you should be ready to empty your bladder. That will help blow out any germs that have been pushed up into the urethra. And then things like cranberry juice, and they have cranberry extract capsules that you can take, or you can just drink cranberry. What cranberry does is it makes an unfavorable environment inside the entire urinary tract. That's from the kidneys, the ureters, which connect the kidneys to the bladder and the urethra, which is the tube that you urinate out of. In a woman, it's about an inch long. In a man, it's as long as his penis is long. So that's why men don't usually get urinary tract infections from intercourse, because even if they get bacteria, they're only in the distal portion of the urethra of the penis. And when they ejaculate or urinate, they blow all of that out, and it's not a problem. Whereas women, it's a very short distance. And oftentimes, when mother tells you to wipe from front to back, that's very serious, because when you wipe from back to front, you're bringing bacteria from the rectum, and the rectum and the vagina are only like this far apart, to the front, and that will infect. It can cause a urinary tract infection. The vast majority of UTIs are directly because of E. coli that's coming from the patient's own rectum. That's the most common bacterial pathogen in a urinary tract infection. There are others, but E. coli is the most common, and one that you've all heard about. You hear about E. coli in lettuce coming from farms where they're contaminated with feces. E. coli is just one of those bacteria that it's in everybody's body. And when it stays where it's supposed to stay, in your rectum, in your large intestines, it doesn't bother you and you don't bother it. But and females in particular are very susceptible to infections, urinary tract infections in particular, because of that relationship. If you have if you have extra skin down there, or you perspire a lot, you're wearing panties, the panties get wet, they cause a direct line from the rectum to the vagina and the urethral orifice, and can contaminate you that way. So very important that we maintain good hygiene down there, that we wipe from front to back. And we can use, I really like the baby wipe types of things, not just dry tissue. Dry tissue does a halfway decent job, but not a good job. And there are baby wipes that will totally eradicate bacteria when doing so. And I also recommend that you use them post-intercourse. Very good for a quick cleanup. Then you can get up and take a shower, or just keep a soapy wet washcloth right by the nightstand, so you don't have to blow the whole mood by getting up, cleaning up immediately. That's just kind of like you're rejecting your partner. So you don't have to do that, but you can do and take care of the amount of stimulation that we're talking about. Okay, great question. I have a family history of pancreatic cancer. Those who have succumbed to the disease were both heavy drinkers and smokers. I am neither, but I am concerned. Is there a test or procedure to check my pancreas just to be safe? Okay, very good question. This might be the question of the day, Ernest. You're going to get the award for the question of the day. Pancreatic cancer, again, runs in families. I have patients now that are, their grandfather passed from it, their father passed from it, and now they are suffering from stage 4 at a very young age in comparison. So very important that one of the things you can do is optimize your immune system function, taking probiotics and vitamin D. The normal level of vitamin D is 30 to 90. It's measured in 30 to 90. If your vitamin D level is 60 or higher, it's found to be protective against a variety of cancers, including colon cancer, prostate cancer in men, breast cancer in women, and pancreatic cancer. The first thing that happens when a person is diagnosed with virtually any type of cancer is that they place them on high doses of vitamin D. It works much better to prevent than it does to treat and or cure. So I would be on a vitamin D regimen immediately. I would also monitor my pancreatic enzymes. You can have that done by your primary care doctor, the internist, or family physician. They can draw blood work on you that can help monitor those things. And that way, if there's no direct pancreatic cancer test, matter of fact, there's not a direct test for the vast majority of cancers that will answer that question other than a biopsy. It's not cancer until the pathologist says that it's cancer. And that means getting a biopsy. Nobody's going to biopsy routinely. So there are routine tests that can make you look further. You get a test and your pancreatic enzyme levels are elevated, or your bilirubin goes up because there's some obstruction to your gallbladder flow. Those sorts of things. You start having digestive changes. If you have a change in your bowel function where your stools change color, or they become oily, or something different. That's the most important thing. Change in what is normal for you. You're not having bowel movements as frequently, or you're having more frequent bowel movements. Whereas you normally would go once a day, now you're going 3 or 4 times a day. Or you normally would go once a day, and now you're going once a week. These are things that will open the door to looking further and then finding. Then you can get everything from a CT scan to an MRI. Those do not answer the question, however. They can still let you know whether you need to look further for some potential other problem. So so you need to be good friends and partners with your healthcare provider to make sure that you stay on top of this and monitor this. Because the problem with pancreatic cancer is most of the time, by the time it's diagnosed, it's already in its latter stages. And very few people survive more than 6 months with pancreatic cancer. Most people are going after 6 months after the diagnosis has been made. There are prolonged cases. Alex Trebek from Jeopardy, he lived almost 2 years from it. But Alex Trebek was a multimillionaire with a whole lot of money to spend treating his disease state. But still, the pancreatic cancer ultimately did consume him. He just had an extended life compared to, regular people, if you will. And I like to talk about the things that I talk about in healthcare as far as regular people are concerned. And that's you and me and everybody else is in the world that may not necessarily have access to a lot of extraordinary means. What are the things that I know that I can get, the things that I do recommend for you and things, but, under other circumstances, I may tell you there's an extraordinary treatment that's available in Canada or in Germany or something like that. And you might need to go evaluate that to do that. But for my recommendation, Ernest, partner with your primary care doctor, start monitoring these things, let them know your family history so they'll stay on top of it. There are genetic tests for cancer now that only will determine your genetic predisposition. A positive genetic screening test for cancer does not mean you have cancer. It just means that you're more likely to get it than someone who doesn't have the appropriate gene structure. But I know that because of your family history. You say you have multiple family members that have succumbed from the disease. That being the case, I already know that you have a genetic predisposition. And so I don't necessarily have to do that test on you. Not a bad test to get, but still there are other tests that are much more apropos for this disease state. So glad you don't smoke. Drinking in moderation is probably okay. You don't have to be a total teetotaler, but you said heavy drinkers, and we're not talking about heavy drinking. We're just talking about drinking in moderation on occasion, and you probably be okay to do that. Okay, great question, Ernest. Good evening, Felicia Jordan. I want to know if sea moss is a good thing to take. Yes, sea moss is absolutely amazing. It helps benefit and boost your immune system. It helps a variety of things as far as your cardiovascular system is concerned. It's one of those supplements that I do recommend. There are other supplements that I like as well, like elderberry extract. black seed oil. All of these are good things. The black seed oil, again, because it's an omega oil, that's one of the reasons that it helps you, but you can get more benefit from just taking omega-3 fish oil directly at the appropriate dose. But again, the answer to your question is, sea moss is a good thing to take. It is. I recommend it. But that's always in all supplements, including the entire lipo line, are never instead of medication. They are along with medication that may have already been prescribed by your doctor. So if you have high cholesterol, omega-3 fish oil will help lower your cholesterol, but it probably won't lower it as much as you need to have it lowered if you've already been offered medication for it. So that's not instead of, that is in addition to any prescription medications that you may have. That is why we call these things supplements. They supplement whatever else you may be taking, including prescription medications. So great question, Felicia. We appreciate that. Tam Scorpio's finest, West. Hey, Tam, thank you so much for tuning in. We greatly appreciate that. How long does it take to get rehydrated if you are dehydrated? You can rehydrate literally in a matter of hours. The best thing to do is not become dehydrated. The problem with dehydration is by the time you get dehydrated and you start to really feel thirsty, you're already dehydrated. So particularly if you're exercising a lot, if you're outside in the heat, or you're doing running or whatever, you need to make sure that you hydrate yourself before, during, and after. So before you go on to exercise and you're going to perspire a lot, you need to drink water. During exercise, don't hesitate to stop exercising for a moment. Take some water in, rehydrate your body, particularly if you perspire a lot. You can really perspire liters of fluid at a time from your body. Your body is very effective and efficient in perspiration, which is good for cooling your body down and keeping your core from getting overheated. So this is a positive thing. Some people perspire more than others, and that's not necessarily a fun thing, but it happens. So the key thing is you can literally be rehydrated, and oral rehydration is just as effective, if not more so, than IV hydration. So if you are capable of drinking, you can drink. And water is one of the best things to rehydrate yourself. You cannot rehydrate yourself with coffee, tea, juice, or sodas. Even though the liquids, you cannot do that. It needs to be water or something like Gatorade or Powerade, which also has the electrolytes in it. But unless you are truly dehydrated and your body has an electrolyte imbalance, regular water will rehydrate you, and your body has the electrolytes to keep your electrolytes in your blood serum balanced. So you don't need really anything other than plain old water. It doesn't have to be some exotic imported from France water, or it doesn't have to be filtered water. It doesn't have to just regular tap water. Wherever you live, the tap water meets the criteria. But if you want to drink bottled water, fine. But in a lot of places, where people are drinking more bottled water than tap water, the tap water of most municipalities is supplemented with fluoride. Fluoride was added to the water to strengthen your teeth and bones. Well, people are only drinking bottled water. They never get the fluoride, so they have bad teeth, bad dental hygiene. Their teeth break off. Their teeth are rotten and are carious. They call that dental caries. They have gum disease, and their bones are brittle and they're fragile and they break easily. So it's always good to drink water coming straight out of the tap as part of your regular regimen. You can drink bottled water on occasion, but good old tap water has the supplements, or make sure that you're taking, say, calcium in and some fluoride as well to help keep your teeth and your bones strong. Great question, Tam. Okay, Kizzy Walker Clayton, so glad to hear from you. Years ago, I had a partial thyroidectomy. After years of taking medication, my thyroid panel is normal, but my symptoms, which are fatigue, dry skin, weight gain, loss of hair, still persist. Should I be taking the NP thyroid? This is a type of natural thyroid that I greatly prefer versus there are several. There's Armor, there's Nature Thyroid, there's NP Thyroid. There are probably at least 5 brands out there that I recommend. But the number one most commonly prescribed thyroid replacement is called Synthroid. Synthroid means synthetic thyroid. Okay, it is good enough to relieve your symptoms, but it is not the best option in reference to thyroid panel. And the key thing with you, Kizzy, it sounds like your thyroid panel may be within the normal range, which means you could be, if this is low and this is high and everything between my hands is normal, but right in my face about here, that's midway. You want to be worst case scenario there. So ideally, you want to be on the higher side of normal, and sometimes even outside the range on the high side. That will keep your skin from being dry, enhance your energy so you're not fatigued, and stop you from losing weight and losing hair. So that is again, it requires your endocrinologist or your primary care doctor to understand this and to be sensitive to it and know that pushing thyroid to the optimal levels is a very good thing, not a bad thing, and nothing, it's not risky. You need to make sure that as long as you're within the upper limits of normal, you'll get much greater benefit from your thyroid than you would the lower limits of normal. Say, for instance, the active thyroid hormone is T3, and the normal range is about 1.5 to 4. Ideally, you want to be 3 or greater, somewhere between 3 and 4 will give you the best benefit from thyroid replacement. And then you should also monitor it regularly. One, make sure you're taking your medication every day. If you've been on it for years, then you have medication fatigue. I know sometimes you just don't want to take it, or you get tired of taking it, or you forget to take it. All of those things are real. That being the case, you want to, I tell everybody, keep their medications close by their toothbrush. You wake up in the morning, you wash your face, brush your teeth, you take your medicines. And that way you've already knocked them out. Very few medications require you to eat food when you take them. It's just usually not necessary. As long as you drink enough water. Thyroid is definitely one of the medications you don't have to take with food. So I would take that in the morning, as a part of your regular regimen, and push the dose to the highest level possible. And if you're converting from Synthroid to any other type of thyroid, there is not a one-to-one conversion. So you need to make sure that you are at a compatible dose. And while you're adjusting, you can adjust it and titrate it up as often as every 2 weeks. And then I would check the levels and keep pushing until you're at the highest level of thyroid. And you will really find great benefit, particularly for your hair and your weight. When you get your thyroid optimized, but you'll have so much energy, you'll be the Energizer Bunny. You just will feel phenomenal. And just from normalizing the thyroid, it was thought that most people that are overweight, one of the underlying causes was low thyroid. And that is indeed true. You can push thyroid. And before we had a lot of the other things like the lipo line, one of the things they would do was give people thyroid shots to make them lose weight. All the weight loss clinics were just giving people thyroid. Then once the oral preparations became available, they would give them oral thyroid medications. Wouldn't necessarily say it was thyroid. They just say this is your weight loss pill and boost people's metabolism and make them lose weight. And it's an effective way of doing that. Not my first choice by any stretch of the imagination. But again, that was one of the few things that was available back then. We got a lot of great things available now, like our Lipodrops Max, our Keto Max formulation, etc., that can help get the weight off as well. But neither of those are a substitute for thyroid replacement. If you need thyroid replacement, you need to make sure that you're getting it at the right dose, at the optimal dose. That's the phrase you take back to your doctor. I need optimal treatment for my thyroid disease, and I want to be on the highest sustained level of thyroid hormone replacement that I can tolerate without any side effects. Okay, great question, Kizzy. Andrew Burnett, Dr. MJ, thank you. I have anxiety. I think depression. Is it safe to take the vaccine? Absolutely, the vaccine does not have, but the disease state and worrying about catching COVID is making a whole lot of people anxious and depressed. So the whole pandemic is depressing a lot of people. The anxiety is every time I walk on my door, am I exposing myself? Am I going to catch it? Am I going to get it when I go to Starbucks? Am I going to get it when I go to the grocery store? Because people will tell me, they say, I haven't gotten the vaccine because I don't ever go anyplace. I say, yes, you do. You go to the grocery store. This I know. Everybody goes to the grocery store because you have to purchase your food. You're going out to get foods to eat. You're going places that you're not counting as, quote, places you're going. People think when they say going, they think about socializing. I'm not going to parties. I'm not going to restaurants. I'm not going to the movie theater, but you're going to a whole lot of other places. And so you're getting exposed. So yes, get the vaccine. The vaccine is safe. The vaccines that I recommend are the Moderna. I would get 2 shots. If you know at any point that you have been infected with the coronavirus and you recuperated from it and you had a normal antibody response, then you won't need more than 2 additional doses. If you don't think you've ever had it or know without question that you have not, then a booster of the Moderna is good enough. They are already talking about a 4th booster, particularly of the Pfizer vaccine, because the Pfizer vaccine is losing efficacy in a short period of time. The Moderna, it just works better. At this point, it has always worked better. The Pfizer people will tell you it works better. Everybody. And even when you have gotten your primary vaccination with any other brand, the recommendation from the CDC is now you get a booster with the Moderna. So if you got the Johnson & Johnson, you get a Moderna booster. If you got the Pfizer, you get a Moderna booster. And if you got 2 shots of Moderna, your 3rd shot should always be a Moderna booster. You should never revert to either of the other vaccines. Those are the only 3 vaccines that are available in the United States right now. There are at least 6 that are being utilized around the world, including those 3. But I tell you, the Moderna is a hit. It works. It's wonderful. It's one that Dr. Collier is highly recommended. Next question. I'm taking omega-3 fish oil supplements. Is it necessary for me to keep taking the black seed oil? The omega-3 gives you the vast majority of benefits from the black seed oil. There are a few other benefits that you get from black seed oil, so it just depends. But you can't go wrong with the omega-3 without question. But the black seed can offer you some additional benefits. You can even take both. It's not an either or. There's no downside to taking both products. You can do that and be optimal at that point, because you're getting all the benefits of the additional things that are in the black seed oil, plus you're getting the benefits of the omega-3 fish oil, which helps with your cardiovascular health, i.e. The linings of your arteries. There's a cell called the endothelial cells. They are like tile in your bathroom. That is inside of every artery, and they are not just passive lining cells. They actually serve a neurohormonal function in your body, and they are literally the #1 largest organ in your body, the endothelial cell system. So you get great endothelial cell health by taking omega-3 fish oil. It helps tremendously improve your cardiovascular health and lowers your cholesterol, lowers your triglycerides, helps decrease your chance of having a heart attack or a stroke. And so there are other benefits from black seed oil that you can get, but the omega-3 fish oil, those are the benefits of it. And they're not necessarily diverse from the black seed oil. There's some crossover with both of them, and you can take both if you like to take the oil supplements. Black seed oil is one I do recommend, but I take omega-3 fish oil every day myself. Next question. Okay, my workup showed that my testosterone levels are low. What would be a great supplement taken on to boost my testosterone level, and why is it important for women to have a normal testosterone level? Angela Haynes Lewis, I could kiss you. That is an absolute great question. And because a lot of women don't understand that testosterone is important for their physical and their sexual health. Testosterone is responsible for your libido, so it gives you the desire to want to have sex. Testosterone supplementation makes your vagina thick, tight, and moist. So it makes you want to have sex. It makes your vagina a more receptive sexual organ, so that you don't have to suffer from dryness or any other problems like that. And it again builds your muscle mass, decreases your body fat, makes you a better version of you. So testosterone levels in women are one of the things that happens when you get treatment called bioidentical hormone replacement, or BHRT. That is one of the services that I offer in my medical practice, and I have more women than men that get the bioidentical hormone replacement therapy, that in the vast majority of women will include testosterone along with other hormones. So testosterone is great for those things, to give you that youthful zeal, make you the alpha woman in the room, make you want to be and make you the best you that you can be. But again, you have to be prepared. I tell people, when your libido increases like that, you are a sexual person at that point, and you want to make sure that you have a willing partner, and you want to make sure that you're using birth control, because wanting to have sex all of the time and having sex all of the time and not using birth control oftentimes results in a pregnancy that wasn't planned. So it's very important that if you are in your particularly in your 40s, you don't want to surprise babies. So if you have not had your tubes tied, or you're not permanently using birth control and just using condoms or other intermittent types of birth control, it's very important that you are counseled on what can happen. And so it's very important, because it does happen, because you are just again, you're highly sexualized under the influence of testosterone, and it also makes your body more pregnancy able and capable, so you're more capable of becoming pregnant. Okay, great question, Angela. Yolanda Turner, my daughter has lupus and her hair in the front is coming out of the scalp is scarred. What can she take or use to help? She's on medication for lupus. The most common medication for lupus is steroid, prednisone usually, to help calm down the inflammation. Natural anti-inflammatories, once again, such as vitamin D at a dose of 5,000 international units per day, omega-3 fish oil, and probiotics. I tell all my patients that suffer from autoimmune problems, particularly lupus, they need to keep these anti-inflammatories as a part of their treatment regimen, in addition to whatever else they're being prescribed, because all of the problems with lupus are inflammation. Lupus causes inflammation of the skin, inflammation of the lungs, inflammation of the kidneys. You can get what's called lupus nephritis, which is the inflammation of the kidneys, all kinds of problems. And you treat inflammation with anti-inflammatories, and natural anti-inflammatories that won't cause any harm and that are also compatible with the primary therapies are very good supplements to take and just will overall improve her health. And so we want to make sure that she's doing everything she can do. Now, if she has scarring on her scalp, unfortunately, then you have lost those hair follicles. They're not going to grow back. You can surgically reimplant hair follicles. They will literally take hair follicles from the back of your neck and move them up to the front. That's the most common technique that they use for male pattern baldness, but they do it in women as well. They can literally elevate your scalp off your skull, pull it forward and sew it back down and advance it so that area is covered and you don't have bald spots there. But the scarred area is not going to grow hair. It's never going to grow hair. Just can't be brought back to life. The hair and the pores there are covered over, and so that area will not be hairless. You can always use other things to cover the defects as well, like of course hair weaves and wigs, which are very popular nowadays anyway. So she won't be any different than anybody else that's out there with weaves and wigs every day. It's just part of fashion now. So she won't be any different from that perspective. But there are things that can be done. But again, that cannot be fixed, but it can be repaired by some of the methodologies that I talked about. But they have micro implantation of hair follicles, again, where they harvest hair follicles from the back of the neck, the occipital scalp, pull them forward and implant them with a little plug planter. And they can do thousands of those at one time. And it gives you a great normal hair response. The hair grows just fine and it looks natural and normal. In the early sciences, when they did that, the technique would bunch up the follicles and it looked like a hairbrush. You'd have bundles of hair that you could look right through. But now the technology has improved so much that it literally, you can't tell it any different from a regular hairline. So that's something that you can aspire to, and she can aspire to if it comes to that. But again, so that we don't get any other damage to our body from the lupus, she needs to be on anti-inflammatories, and I recommend the vitamin D, omega-3 fish oil, and even the probiotics. Okay, great question, Yolanda. Okay. Monet Justice, I just purchased your Lipodrops Max. It seems to suppress my appetite. Is it supposed to do that? Yes, it does. That's one of the benefits of taking it. But its primary function is to optimize your body's metabolism of fat. The thing is, fat is a fuel. When your body is getting the fuel that it needs, it doesn't give you the signal that I need fuel, which is hunger. So you're going to decrease your appetite because your body is metabolizing fat. It's utilizing the fat as fuel. And when that happens, you're just not going to want to eat as much. Now, there are people that eat around that. And so you're losing some of the benefits of using the Lipodrops Max, because that's one of the things it's supposed to do. It doesn't do so in an overwhelming fashion, not in any negative way, but you just aren't hungry. And when you aren't hungry, as long as you don't eat as much and you stop eating as soon as you feel the sense of satiety, ergo you feel full, don't force yourself to continue eating. I have now gotten to the point where I'm eating about half per plate of what I used to eat. And that being the case now, it's much easier to push away from the table. But I have a sense of satisfaction. I feel full. And as soon as I feel full, I stop eating. And one of the things that has happened is Dr. Collier has dropped. Now I'm at 29 pounds. My goal was 30. I'm going to hopefully stabilize about that point. But this morning I weighed myself prior to this Facebook Live so that I can make that announcement, down 29 pounds. And as you can see, skin is loose here. My collar now, I can get 3 fingers in my shirt collar, whereas before the shirt was snug on my neck. So I'm at the point now when I'm going to have to do some shopping for some smaller clothes, which is always a good thing. But when you're losing weight, you want to make sure that you're going to keep the weight off before you buy smaller clothes and dispose of all your current wardrobe. So we're shifting little by little. I buy a couple of outfits every week. And then, eventually, hopefully, we'll be able to sustain this. But I literally utilize the Lipodrops Max and the Keto Max on a daily basis to help optimize weight loss. So great question. Thank you, Monet. What is good for iron being low? One, Edward, particularly in a man, you want to find out why the iron is low. Low iron is not a good diagnostic sign. It's easily replaced. Any complete multiple vitamin with iron and minerals can replace iron. But the question is, why are you losing iron? For women, it's a little easier, particularly women of childbearing age. If you're still having menstrual cycles, the vast majority of women are anemic because of their menstrual cycle. The only time they're not anemic is when they're pregnant and they're not bleeding and they're taking prenatal vitamins. So they build their blood back up and then they have the baby and then they go back to being anemic as soon as they start having regular menstrual cycles again. So, for a man, I would take a supplement such as any complete multiple vitamin. A couple of name brands would be Centrum, Zbeck, one a day for men. Remember this about vitamin therapy. Vitamins are a fixed chemical formula. There's no better way to make a vitamin. If you're spending more than $10 for 100 vitamins, you're paying for a pretty bottle, a nice commercial, and a celebrity endorsement. So again, you ought to be able to get a vitamin that because there's no better way to make them. A vitamin is a vitamin. It's a fixed chemical formula. So go to the store when you buy it and get the brand compatible too. It's the exact same formulation, and you can do that. You don't have to buy the name brand. You can buy the Kroger brand, the Publix brand, a generic brand that will say. I love the ones that say compared to a name branded product because for vitamins, it's not the same for everything, but for vitamins, fixed chemical formula, just get one that you are. Okay. So we have reached our time limit. I want to thank each and every one of you for coming out tonight and participating in the Your Health is Important broadcast. It's always a pleasure because I know that you guys have choices and that getting this medical information is just nice. I'm so happy that we have people that tune in regularly and that we are enjoying each other's company and fellowship. And so that's where we are with that. So thank you once again. We are so glad to have you here. This brings to an end this episode of Your Health is Important, the Facebook Live broadcast, brought to you each second and fourth Wednesdays at 6:30 p.m. I am Dr. MJ Collier, your host, producer, and on-air personality. We want you to go to our website, lipodrops.com, to learn how you can boost your immune system, how to lose that muffin top with Lipodrops, and how to get your beach body back now. You start now. The next few months when spring and summer comes, you start to travel, you'll have the body that you want. Thanks again for tuning in. We appreciate you and love all the listeners. See you next time.